Hi everyone, in today's video I'm going to go through and explain what is non-alcoholic fatty liver disease slash MASLD and explain why there is a new name change. I'm going to explain how it progresses, how do we find out we've got it, and what's the quickest pathway to a healthy lifestyle and improving this disease. My name is Bali, I'm a liver dietitian and looking forward to spending some time with you today in this video. Right, let's get straight into it. So what is NAFLD and how does it present itself? So understanding the name change. So NAFLD is non-alcoholic fatty liver disease and it's defined as a buildup of fat within the liver. But now since recently there's been a new name change to something called MASLD. And that's to reflect the other changes that occur when somebody has this disease. It's also to reflect that actually it's not just a buildup of fat within the liver, it's actually caused by a wide range of metabolic issues. And it's not just the absence of alcohol, because we now know that even though people who do drink, they can still get this type of liver disease. And it can be a combination of two things. We also know that it's not just people who are overweight that have MASLD now. We know it's not just people who are clinically obese. Others can have this disease and condition as well. So that was why we've had the recent name change. MASLD is driven by metabolic syndrome, and key risk factors include overweight, obesity, predominantly excess belly fat, type 2 diabetes or insulin resistance, high blood pressure, and unhealthy blood fat levels, so different changes in cholesterol. A lot of the time, people have a majority, so they might have one or two of these, or they might have three or four of these. And as you can see, the more and more that build up, the more unhappy and the more annoyed the liver gets, the bigger it can get, and the more unhelpful it can be as well. The disease itself is actually very silent. It's a silent progression, and it happens in several different stages. You first get the little bit of fat buildup and energy buildup in the liver called steatosis. You then get some level of inflammation, which is what we start to call MASH. The liver becomes inflamed and damaged. You then start to get some scarring, which is fibrosis, which is persistent inflammation. And this scarring doesn't really change too much. Now, when the scarring gets worse, it leads to cirrhosis. Over time, cirrhosis can lead to cancer buildup in the tissue, but essentially the biggest risk is it leads to liver failure and death. So how do we find out that we've got something that's a silent disease, essentially? And there's lots of different diagnoses, and a good clinician will probably do a couple. So first is rule out and and do a test for all those blood tests that we talked about earlier. So your diabetes blood tests, your blood cholesterol tests, and then we might do some of your liver tests as well. When your blood tests show that your liver is slightly stressed, the enzymes can come up as slightly inflamed and higher than the normal range value. And those subtle changes can then lead to doing something like an ultrasound, which can see fat around the liver, or a fibroscan, which can be a little bit more accurate and that actually measures the stiffness within the liver and the level of scarring. And then on top of that, we would have a clinical assessment. So what other symptoms do you have? Tiredness, fatigue? Do you have obesity? Have you noticed any pain, any dull ache on the side of your liver, or any other symptoms that they would ask in a clinical assessment? So what's the pathway then to healing, essentially? The liver is amazing because the liver can actually heal itself to a certain point. And predominantly, this condition is reversible. And the earlier we catch it, the more deaths that we can prevent. The key is addressing the key root of those metabolic causes. And this is often a combination of lifestyle, diet, exercise, weight management, stress management. And in some people, they will also need medication as well. It's not a one size fits all approach. It genuinely depends on the person. However, if we try to improve all of these aspects of our life, then slowly we'll start to see some improvements. At different stages of the disease, we have to have different approaches. So what are the key takeaways for you guys to take in? Sorry, disease progression is predominantly silent, and the liver can become damaged over time. A lot of the factors are treated with lifestyle changes, and it can definitely be reversible, but it will take a little bit of change and a little bit of effort as well. It's important to get regular checks if you've got one or two of these symptoms, or if you've already got diabetes, or if you've already got high cholesterol. This will put you at risk of having a bad liver. So actually, it's important that you get checked and then you get referred and you work with a dietitian. Your doctor will not be able to help you reverse this by yourself. You need to be in a dietitian clinic and doing predominantly lifestyle management and treatment and being on the right level of nutrition. Thanks for watching today, guys. If you have any questions, let me know, and I'll try and answer them in the next videos. Cheers. Peace out.